Okay, so I was called by the insurance company the other day to renew for my insurance, which everybody has to do at least once a year. And I lost my insurance because apparently I make too much. And they offered me the different plans that they have. And the lowest plan that they had for two people was $372 a month with an $8,000 deductible. Let's try to figure that out. So I don't have any chronic illness. My husband doesn't have any chronic illness. We're not on any medication for anything. And if I go to the doctor, it's once a year. Other than the regular checkup, I would go to the doctor once a year to do blood work for tick bites, just because I live on Long Island and the east end of Long Island gets a lot of tick issues. So I always check for that. So I don't even know what that costs out of pocket, but I just know that I'd never use the doctor. So in order for me to make that make any sense, I'd have to be spending $8,000 out of pocket a year, and then everything over that would be covered, like $20 for a doctor's visit, $50 copay, whatever that is. It just doesn't make any sense. So it's such a scam because we're paying $372 a month for nothing, really. It's like, actually, I think you probably get more out of car insurance, because if you get a fender bender or a glass coverage, your deductible, if you have a deductible, it's probably, usually it's like $500. So at least you get something out of that. I don't think most people use $8,000 a year in insurance. I mean, in their healthcare stuff. I don't think they do, unless it's, it only makes sense for somebody who has comorbidities, or like if you have, I don't even know what the drug costs are. If you just had cholesterol, if you're being treated for cholesterol, you probably don't even meet that deductible. It's probably still low. But yeah, at $372, $8,000 deductible, makes no sense. 20 years ago, when I first got health insurance, when I was new to health insurance, I was 24, and my husband and I were just married. It cost $442 a month, including everything. It included your copay for your doctor. It included your $50 ER copay, your dentist, just regular checkup, your eye doctor, just regular checkup, $442 a month for two people. And now it's completely out of control. And by the way, 75% of the U.S. population is on at least one medication for a chronic illness. 75%. So of the 25% that's not on anything, I would gather to think that most of the 25% are younger, way younger than me, because kids don't, young people don't really get too many illnesses. It's not till you get older. So what happens then? I'm disgusted that that I'm paying for somebody else's bad health. Like, a lot of times I think it's choice. It's how you live. And I'm being punished. Actually, I should say it that way. I'm being punished for somebody else's bad choices. I don't even know how we're going to make any of this work. I don't know how we're handing this down to our kids. The only good insurance you can get is if you work for the federal government, the state, the county, and a really large company. There's no such thing anymore as having good insurance anymore if you're like a small company, or if you work for yourself. It's just, there's no such thing. So I would advise you, take good care of your health, do the best you can, because I don't see this changing at any time. That is what it is.